Tonight we're here to explore the possibility of hearing our own song from a woman who's been practicing very deep work for many, many years. Dr. Mia Kalef was a chiropractor and has worked in craniosacral for over 16 years. And that's such a very tiny part of all that she is and all that she passes on to others in the work that she does one-on-one and in groups. She is an inspiration. The work that she does, if any of you have actually been touched by it in this room, and I imagine that a few of you have, is deeply personal, deeply intuitive, deeply healing, deeply respectful, empathetic, and compassionate. She's able to offer a journey of taking us back into the time of our pre-birth and rediscover parts of ourselves that may have been left dormant, may have been left out of the integration process of our becoming who we are. And allows us to touch those things and reconnect with them and reintegrate them at any time in our life. I find that a miraculous gift. And I'm not just a good friend, I'm a client. I've experienced that after many years of going to body workers and craniosacral people and chiropractics on things that I've had. And yeah, it's amazing, the gift that Nina has. So when she asked me if I would introduce her tonight, I said, yes, by all means, I'd be honored to do that. She's also a passionate believer in intentional communities. She's also very committed to bringing in the practice of the rites of passage back into the culture. And her continuous quest for wisdom and eldership has led her to work with some amazing wise beings. And she's a traveler and personal assistant of one of the 13 indigenous grandmothers. You need her now. I can't say anything more about this amazing woman. Please give a warm welcome to Mia Kalef.
This is called the Song of the Spirit. There's a tribe in East Africa where true intimacy is fostered even before birth. In this tribe, the birth date of a child is not counted from the day of its physical birth, or even from the day he or she is conceived, as it is in other village cultures. For this tribe, the birth date of a child is set the very first time the child is a thought in his or her mother's mind. Aware of her intention to conceive a child, the mother goes and sits under a tree until she can hear the song of that child. She returns to the village and teaches it to the father so that they can sing it together while they make love, inviting the child to join them. After the child is conceived, she sings the song to the baby in her womb. She then teaches it to the old women and midwives of the village, so that throughout the labor and the miraculous moment of birth, the child is greeted with his or her song. After birth, all the villagers learn the song of their new member and sing it to the child when she falls and hurts himself or herself. It's sung in times of triumph, in rituals, and during initiations. The song becomes a part of the marriage ceremony when the child is grown, and at the end of life, his or her loved ones will gather around the deathbed and sing the song for the last time. What I'm proposing to you tonight is, what if this song was always there, and not in some faraway place or another time in history, but was in this room, in me, in this plant, maybe in all of you. I'm asking you to consider that. And that maybe the work of change or healing is actually about revelation, or revealing what is concealed and has always been there. That no matter what hardships or circumstances you've endured at any time in your timeline, that perhaps this reverberation that is you has always been whole and intact. And our work in this world is to clear the path so it can become more revealed, more heard, experienced by us. I'm also opening up the possibility and suggesting that what if this work of revealing wasn't only personal, to bring betterment to ourselves and to our own lives, but what if it was on par or synonymous with social change? What if it was synonymous with social justice? What if the work of recovering our systems around sustainability and all the challenges we see in the world were about revealing the song within the systems, not only in ourselves? I want to share with you a story about one of the most important relationships I've ever had in my life. It was with my dog. Lendl was found lingering on the streets of Calgary, deeply unfed, dried out, bony, and he was brought to the pound where I met him. And at first, he was so shy and so quiet that I thought his name should be something like Newt. Something unassuming and not dangerous, not wild. After a lot of gentleness with him and sitting with him and talking with him, it was about 2 months later, he went outside one day on a hot summer day and just ran wild. And I got to see what he was really made of, and I had to change his name. About 2 years later, I discovered that he liked being violent to other dogs, as dogs will do. He was a very dominant dog. So if you have a dog, you know that when the dog is dominant, it attracts all the other second and third string male dogs or female dogs who will come and mount the dog and wrestle for first place or the alpha position. Because I believed in his inherent goodness and the possibility that his violence was not his nature, I decided I've got to find out what's at the bottom of this. And I actually came here to this library and found a book that said, sit, heal, stay, 10 minutes a day, should do the trick. And sure enough, after 2 weeks, he was partially domesticated. Now, what I discovered with Lendl was that there was this line I could have gone further with, which would have been to train him not to chase squirrels, not to run out in the street first thing in the morning. I could have taken his domestication a little further, but what I noticed is there was this edge past which I would lose the beauty of what his wildness was offering me. His capacity to perceive the world was so much greater and finer than mine. He could tell me who was 3 blocks away and coming to the house. He'd be able to tell me in a person's session what they were going through much better than I could perceive. So even though he had a portion of himself that was domesticated and a portion that was wild, he was no less present, even though he was domesticated. And the reason I'm telling you this story is I perceive that is where we are in our history right now, is that we have fallen under domestication, not only in our persons, but in our systems that are in the world. And I'm suggesting that perhaps all we need to do is not change, tear down ourselves or the systems, but perhaps just adjust that line, that threshold, just back a bit so that the wildness, the nature of life can be sung into all that we do. So this work of recovering ourselves, of perceiving who we were when we were first sung in, I believe is also a gateway to the social change and social justice. So I'm going to describe a little bit about what those systems have noticed in their presence, mainly science, what science has had to offer us about who we were at that very small, small time. And at the end of our journey tonight, I'm going to be inviting you to join me, 7 people at a time, once in January, once in February, for a healing experience or a revealing experience, where we will partake in a 4-day journey that will reveal to you places in your own coming in, sometime between just before you were conceived and the first year of your life, the end of the first year of your life, and what you may have missed potentially from that time that your song was slated for, and what kind of intimacy you might be able to bring back to yourself and celebrate who you are. And if that's not for you, I'm going to invite you to walk away tonight carrying a piece of this conversation. And I'm going to suggest that it is our moral imperative to spread awareness that our ability to sense our lives as we were being conceived all throughout our growing time in our mothers and our birth is an important time for us to pay attention to and to protect and celebrate in life. And that our social systems partially rely upon our recovery of that memory and that intimacy. All right, here we go. So I have decided that I wanted everyone to have a copy of this book I wrote 4 years ago. And it's been under renovation for 4 years with a lot of wonderful feedback from midwives and doctors, and mothers have all said to me, you know, that chapter is a little too early in the book for me to take it in fully. So I wanted to gift it to you because it is still my natural voice. It was the first time I put any of these words out into the world, and a new edition is coming. But if you already have one, maybe you'll pass it on to someone you know. But in it contains information that could be speaking points about what I'm going to share tonight. So I hope it supports you in the journey I'm asking of you. So you'll find in it that there are 4 principles around which this work organizes. And when I say this work, I mean what I've noticed my predecessors and mentors have discovered, and science. The first principle is babies remember their experiences, which means we remember our experiences. Now, there's a lot of controversy around that. I saw the room just kind of do a little shimmy. And I believe there's controversy around memory because we're taught that we do not sense, or that we are not sentient until we are verbal. And you can guess most children become verbal in sentences around 3. 2, they're asking for things. So it's been commonplace in psychology and in medicine to dismiss the importance of what babies remember prior to the time that they're verbal. Now I want to talk about how is it possible that we would even remember something prior to the time we can put words to it. And there's an enormous amount of wonderful neurology study that's in the world that I'm not going to talk about, but if you want to look at it, I would definitely encourage you. It's very popular in self-help right now and personal development. But I just want to talk about one particular aspect of what memory is described like. So there are 2 kinds. One is called continuous and one is called discontinuous memory. Continuous memory is the type of memory where you say, oh yeah, I remember that time. I was with so-and-so and so-and-so, and I bumped my knee, and it hurt for a while. I went to the doctor. It seemed like it was fine. And you can tell the story from your conscious perception. It's also called explicit memory. The other kind of memory that I'm talking about here tonight is called implicit memory, or discontinuous memory, which does not, as we'll see, reside in the brain. I've recently taken to a new theory as to where I think it does reside. I used to say to people, oh, our memories reside in our bodies. That trauma, if you'll call it that, resides in our bodies. And I think it's partially true. But I've become a bit more interested in the work of Rupert Sheldrake. I don't know if anybody has heard of Rupert Sheldrake. he talks about morphic resonance and the fact that animals and plants discover what form they're going to take by resonating with species of a similar kind that have come before it generationally, rather than genetic material being contained solely in the cells that get exchanged when reproduction occurs. There's actually something that happens across space and time. So when I think about where we contain or store these memories, I think it's very interesting to look at it from a neurological perspective. It's very interesting to look at it from a kinesthetic or body-centered perspective, and I think the work can be done through a body-centered perspective. But my sense is that it's much more complicated and evolved. And again, food for thought if you want to read Rupert Sheldrake's work. It's very fascinating. The second principle is consciousness precedes brain structures. And again, I haven't heard a guffaw, but depending on where I speak about this, whether it's at a neurological conference, sometimes people walk out of the room. There is an obstetrician in Japan. His name is Akira Ikagawa, and he's a colleague of mine, and I met him in 2007 at a conference. And he stumbled into some research that's really fascinating. I'm going to read from his book. He was interviewing children under the age of 5 and asking them if they remembered anything about their birth or anything about when they were growing in their mother's bodies, or etc. And he was shocked to discover that about 30 to 40% of children were retelling stories, almost unprovoked, and stories that their mothers had never told them. And they sounded a lot like journeys into conception, being conceived, and I'm going to read some of them to you. He was so fascinated by this work that he decided to interview 5,200 children in Japan. So what's key here is he took something that is truly illogical and made a scientific study out of it. And it has been subjected to the same scrutiny that medications and other types of surgical procedures are subjected to. So this actually holds weight in science, this work he did. But I'm going to read to you one of the accounts from one of these children. Before I was born, I was something like an invisible ball, so tiny you couldn't see me. And I was playing around, jumping in a place like a universe with no stars. I wasn't happy or sad. From there, before I knew it, I became like a long worm. There were hundreds of us, bumping shoulders and stuff. It was crazy. But in the end, I was the only one left. And one day, all of a sudden, my body started to grow. Every day I grew and grew so fast. At first, I was like a killfish. I looked just like a baby pig. My eyelids were very thick. After a while, my eyelids got thinner, and then I could see the light from outside. When my fingers were done, I would play, rubbing my fingers and toes and doing somersaults. Inside your tummy, it was purplish red. It was kind of slimy, but firm, like a pot. I could hear a sound like running water, and a throbbing sound. Inside was soft and cushiony, and there was lots of warm water in there. I curled myself up. There was a long string coming from my belly buttons that joined me to your tummy. When my body got really big, suddenly, your tummy started to move and pushed me out. When the exit got this big, I went into a mysterious tunnel. The mysterious tunnel would move by itself and push me out. Inside the tunnel was stringing, and my shoulders were caught in it, and it took quite a while. It was a bit tight and hard. At first, it pushed me, but it was hard because I had to get out by myself in the end. I didn't have a problem breathing. When I got closer to the exit, the skin got thin, and I could see outside through it. When my head started to come out, I could open my eyes better. And when I came outside, my eyes opened right up. I didn't want to cry, but my body started to cry by itself. And then I was put in a glass box. So the mother's report, he'd been saying things like this. since he was 3 years old. Oh, by the way, this is Isu Yamamoto, who's 7 years old. He had been saying things like this since he was 3 years old, and when he was 6 years old, he even drew pictures about it. He talked in most detail just after he turned 7. Now at the age of 9, he seems to remember only 30% of it. But there's no way he could have known that he was in an infant incubator. She'd never told him. I'm going to read you one more. It was dark inside Mummy's tummy, but it was warm, and I was swimming. I couldn't wait to see Mummy. When I was born, it was too bright. When it's time to be born, someone will let you know. Now it's time to go. I couldn't wait for Mummy to hold me in her arms. There were many kids in that country over there. And we were watching from up above, saying, "That Mummy looks pretty and kind," and things like that. I made friends with some other boys. There were 3 of us. We all thought it'd be nice to go to Mummy's place, and I came to you, Mummy. I picked you because you were kind. The mother says, from the time he started to talk until he was about 4 years old, he used to tell me this all the time. I was surprised because he couldn't have known that we were going to have 3 boys, but we did. And this is an excerpt of 5,200 children, all under the age of 4 or 7. 30 to 40% of them remembered. So, how is this possible? I mean, how is this possible? If memory is thought to be stored, traditionally, as science says, in the brain, and we're not really supposed to have memories or verbal accounts of memories until we're verbal, this kind of just rattles that whole thing. So I want to describe a little bit about what I know about neuroanatomy and brain development so that we can wrestle with it a little bit. So if we want to talk about memory being stored in the brain as it's traditionally thought of, then we can look at when does the brain first develop. So after you're conceived, around 18 days after you've been conceived, is the very first arrival of what is going to become your brain. And we could say that, okay, it's possible that memory could be stored at 18 days after conception. However, the structure of the brain that gets developed at 18 days isn't the kind of brain that holds these kinds of complex memories. It's called your reptilian brain, or reptilian system, which, if you've ever heard of that, is really designed for fight or flight. It's designed for, is this thing going to kill me? Do I need to kill it, or do I need to mate with it? It's like 3 different decisions. That's about it. So how could this complexity show up that early if not stored in the brain? Okay, so let's go a little further into development. By the 2nd trimester, you're developing a part of your brain called the limbic system, which sits on top of the reptilian brain. Okay, maybe that could explain a little bit about this stuff, because it's really the first time in the brain that you can differentiate between what's me and what's other, or you have just a little bit of a preference, or a little bit of the beginning of an emotion around it, according to neurology, the neuroanatomy. Okay, doesn't quite explain this. Okay, maybe by the 3rd trimester, you develop what's going to become your cerebrum and other more complex places. And then after birth, maybe I'll develop my prefrontal cortex, which could have the capacity for morality or compassion. The 2 don't really line up, do they? So I just want to point out this dissonance that I have with the data. And these are 2 scientific bodies of work. The 3rd principle I work with, and that's actually my favorite, is babies are barometers. So what do I mean by that? What if it were possible that babies have the capacity to be like canaries in the coal mine and tell us something is out of sorts, perhaps before we even are aware of it? Beyond, I need my diaper changed, I'm tired, I'm hungry. What if inconsolability and the rhythm of inconsolability had something to do with the greater environment, which could include their families, Okay, you can imagine that. What if it also included their societies? What if babies were like an organism of the living earth that had a voice, that reflected back to us things we need to know, but that we've lost the capacity to decode or interpret, and we take them as inconsolable, end of story. I want to go one step further and suggest that what if inconsolability of babies, and I don't only mean inconsolability, but for now we'll just say that, are also reflections of their ancestries and unrequited grief or tears of those who've come before them. So to explain this, I've come up with a theory, and it does resemble other theories like family constellation. This appeared to me before I knew about family constellation, so I'll explain it to you. I call it the family field. It seems that the patients that I work with, some of the children's symptoms, especially the babies, don't resolve with hands-on therapy on them alone. I was taught, treat the child, treat the individual for the individual's symptoms. Every time I treated a baby in the old days of my practice, I couldn't help but notice that there was a huge experience going on in my peripheral vision in the mother and the father and sometimes the siblings. And although I didn't have the wisdom at the time to knit them together into a field, an organism all together, I could feel in myself a sense of incompleteness. And it wasn't until about 2003 when I met one of my teachers, Ray Castellino, who had taken all of this awareness from craniosacral therapy, pre and perinatal psychology. He was a former chiropractor as well, and play therapy, and he brought it into this beautiful orchestra of how to work with the whole family at once. And I knew I had to do what he was doing. It raised the bar so considerably. So I'm going to give you a story about a family I worked with that really, I think, demonstrates the family field concept. I met Anne at a conference, and she came up to me and said, when I gave birth to my second child, I hemorrhaged so severely I thought I was going to die, and I was in the hospital for a week. I have a 14-year-old daughter. I think that my baby has some leftover issues from that week of separation and the trauma we experienced, and I'm wondering if you can come and work with all of us. And can my 14-year-old be involved? I said, sure, of course, that's great. I love it when parents are encouraging the logical. So I went to their house, as I do with young babies, and the 14-year-old greeted me at the door. And she was one of those young women who was very vibrant and confident in herself, sort of uncommon, you know, in young teenagers. A lot of young teenagers can feel a little bit shy around people who are so-called authority figures, and she let me in. And we talked and what she was up to in school while we waited for the mother and father and baby to come in. We all joined in. And I had studied the forms that I'd asked the family to fill out, which included questions about what was it like all your life leading up to having this baby? What do I need to know about you and patterns in your own life? And the mother clearly reported that support had been in question for her whole life. She'd had a father who was alcoholic, she never felt supported by. She never felt supported in her first marriage, and this was a running experience she had had in her life. During the pregnancy of this particular baby, they had moved houses twice and cities once. And what we know about women who are pregnant is it's really important to offer them a stable environment so that they can actually drop down and have a nest to relax into. And it's very common that birth can become complicated if there's disruptions in that nesting during pregnancy. So because support had been missing for her, I thought, okay, well, why don't we reenact what support could feel like? So I had the mom lean against the dad on the couch. So the dad was behind the mom and she was leaning on him. The 14-year-old was down at the end of the couch and the baby was on the mother. Do you see that layout? And there's a game we play with babies called attachment sequencing. All mammals, when they're born, have the ability to crawl up the mother's body and attach to the breast after they're born if birth was uninterrupted. We don't do that a lot in hospitals here, But many babies still have that capacity, and if they didn't do it, they still want to do it after they're born. So this is one thing we do with babies to see where they may have been interrupted in their own trajectory of their own birth or somewhere in the pregnancy. So the baby started to crawl up the mother's body, and maybe some of you have seen this. Babies just push with their feet, and they bob their heads. All mammals will do this, and they love doing it. Toddlers love climbing up adults and trees, and they just love this trajectory of pushing themselves into the world, even if they weren't born that way. So this baby starts making her way. She gets halfway up the mom, turns her head to the right, gets stuck, and lets out a huge cry and becomes utterly inconsolable. So when that's going on, I don't want to push the baby. We'd take the baby and give her to the mom, let her soothe, maybe nurse, and we try again when the baby's ready. Baby starts up the mom's body, turns her head to the right again, gets stuck, lets out a huge wail. This time, when we remove the baby from that position, and by the way, that's telling me that this baby experienced a trauma or a severe interruption in her song as she was coming into the world, which probably was where the hemorrhaging started. So we just stop the baby, and I turn around, and the 14-year-old is in total tears. And so I turn to her, and the baby starts to fall asleep. What are you feeling? She's crying. She said, I don't know. I can't believe I'm crying right now. I said, well, what are you feeling? She said, I think it was just that I was so scared you were going to die when my sister came. I was so scared you were going to die, and I just didn't want to tell you because you were already so weak. I didn't want to take anything more from you. And I had to go to school and act like nothing was happening and walk down the halls and just thought I'm going to lose my mind. So she just was having this opportunity to emote and release what she hadn't had a chance to grieve from the 4 months ago when her baby sister was born. The baby continued sleeping. So clearly this is what needed to happen, and this is about an hour later now, and I can see that things are settling down, and the older sister's cuddling with the mom. They're all wrapped into the mother with the baby too. It's beautiful. I said, I'm just going to let you stay here. I'm going to see you tomorrow or talk to you tomorrow. And they looked pretty good. I talked to the mom the next day. How are you? Good. What happened? Well, we spent like 20 minutes on the couch together. We just cuddled and snuggled. It was so nice. And we all decided we were going to sleep in the same bed together that night. And it was so great. And little one slept through the night for the first time. And when we woke up, she turned to me, the baby, she turned to me and looked at me. Oh, and I forgot to tell you this. She wasn't using her arms yet at this point. She turned to me and she just started moving her arms for the first time. And the mother is telling me this, and she's crying, and I'm crying because I hadn't done anything per se with the baby. I had not administered therapy, hands-on or otherwise. It was the 14-year-old whose experience being cleared the path for this baby to move into a whole other level of her neurological development. I presented that story at a neurological conference, and nurses from all over the world came up to me and said, are you allowed to talk about that in your country? And I said, I am. But I was watching one of the neurologists in the crowd while I was explaining that story, and he was tapping his pen and looking for the door. I mean, what I'm talking about is so much of what we understand is a beautiful handhold into this great life that's living us. But there's so much mystery, and I think enhancing our capacity for intuition and imagining that we are sharing a much greater field is really a beautiful way to walk. And it's unfortunate that so many of our systems sort of handcuff us and intimidate us to trust that. So that's the family field. Now, I couldn't help in my life wondering how it came to be this way. Like, I know how it is. You all know how it is. But I started wondering, like, where is the inherent goodness behind these systems that would interrupt us from understanding what I was just talking about. So I started looking at history, and we're just going to journey for a minute into things that don't have anything per se to do with health, but I think they are at the root, or the shared root, of all our systems: healthcare, the economy, governmental processes, etc. So I started to wonder, where did we first get the idea to separate from nature? Where did we first get the idea to dominate nature? And where did we get the idea to dominate our own bodies and to resist what's actually happening? And at the time, I hadn't read the work of Riane Eisler or other people, but Riane Eisler talks about this culture as a dominator culture. And so in my writing, I started to call it the dominance culture. And my definition of dominance culture is a culture that uses largely rational cues for the compass for decision making. And it's predicated on one person winning and one person losing. And most of you, since you live in this city, understand what I'm talking about. The city is gifted with an enormously conscious community who really wishes to see that dissolve in the world. And the proposal I have, or the not the opposite, but perhaps what is emerging, I call it emergent culture. And my definition of emergent, well, actually, I was looking for a word that described the self-organizing principle in nature. I was looking for a word, cross-sector, that could explain how we can track what this baby was doing and what this 14-year-old were doing, where they know what to do. What would be the word? And I looked up on Wikipedia, it said emergent. And it was kind of funny because my company's been called Emerging Families for a long time, and my jaw kind of dropped. I didn't plan that. So my definition of emergent culture is a culture that incorporates not only the intuitive in the human as a compass for its decision making, but resources, nature, animals, basically the silent teachers, including babies, and uses all of those cues, basically dissolves some of the membranes or barriers between itself and the world in order to steward its next steps. So I thought, this is happening in the world. This is coming about again. I'm seeing it in my relationships and my friends. I'm seeing it in all the sustainability movements. So I was suspecting that this is probably a memory of something, that this isn't new. It's an evolved version of something that's been in the world, but it's not brand new. And that's where I started getting curious about history, like when did we forget this and why? I've got more of the when than the why. But I just want to travel a bit with you backwards. So Riane Eisler talks a lot about this in The Chalice and the Blade, that there's archaeological evidence around the end of the Neolithic period, so around 7,000 years ago, where there's the very first evidence of violence, of a kind that is destructive. Not that violence has never been in the world, but the kind of violence that wasn't a mutually agreed upon one. And it's the first time in history, in the archaeology, where there's evidence of broken vases, brokenness in a violent manner. And the theory goes, one of several theories, is that there was a huge amount of the population, mostly goddess-worshipping people, living in the fertile areas of the world, and that outlying tribes, this is not a man versus woman thing, but just how it's been recorded, that male worshipping deity, warring tribes, descended or entered into these fertile areas and began this conflict. And that was my original learning. And then I've started studying with a man named Stephen Jenkinson, who some of you know. And we were talking about, well, when was the first time we thought to do that to each other and why? And he said something to me like, what if simply our capacity to endure trauma changed, or our capacity to move with nature changed? In other words, we were all once semi-nomadic. We were all once in reverence of nature and what nature told us to do. We did not lead nature. We were led. And we agreed that would be how it would be. And the order looked something like this. We follow the animals. We're reliant upon them for our life. And the animals follow the world. And that we walk around, not randomly, but we walk around over the course of a year or several years. We know where our dead are buried. We know our valleys, we know our mountains. We take care of the ecosystem because we know we aren't separate from it. And then maybe just the capacity to accept that when the hurricane comes, or the tornado, or the earthquake, or the drought, maybe the capacity to accept that as how it is and it's okay changed. And maybe then we started trying to control how the world works for us. And you could call that the agrarian period or domestication. So since domestication is in our world, and we are living with it, I don't want to reject it. And I think emergent culture really brings in an empathy and a support for how we can look through the lens of dominance and see where it is actually present to things that are living, but just maybe forgets that it was gifted to us, that we didn't create it ourselves. So if we go back into history and now we just come forward and we come up to the time of, well, we could go through any period of history, but if we say advance all the way up to, let's say, the time of colonialism. So this period of time was beginning around 12 something in Europe. There was a decree that came out from the papacy. So this is mixed in with Catholicism, it's not just colonialism. There was a decree put out that we, and I'm saying we because it was some of us, go forward into lands and claim people, resources, and land. Take it. So it was actually a top-down command that encouraged people to leave their motherlands. And in fact, the word metropole or metropolis actually means mother city. So people went through this very separation from birth-like experience where they cut ties to their motherlands, and they either journeyed on behalf of the monarchy or in reaction to wanting to leave the monarchy and came to places like here and began the scooping up that we are attempting to recover. This all reached a peak, let's say 200 years later, in what was called the Enlightenment, ironically, or the Age of Reason. And René Descartes, if you've probably heard of him, he's famous for the quote saying, "I think, therefore I am." And what he meant is that God, consciousness, the life that's living us, is separate from us. It's outside us, and we are the machine that basically transmits the commands, rather than it being within us. And that became very popular in medicine and science and philosophy, and it became our norm that we are still actually living in today, for the most part, the dominance culture. And if we go a little further along and we start to come up into the last several hundred years, and we just even look at birthing practices, it has shown up there too, that we cannot trust that our bodies, men too, know how to heal, how to birth in the case of women. And that lack of trust has really filtered into pretty much everything we do. So I know you know what I'm talking about. And I'm saying it nonetheless because I want to celebrate what we do know and really give honor that when we do the healing work of today, I suspect one of the reasons it's not simple and it's slow and it's hard is we're standing under enormous channel of ancestry, cross-culture, that actually we have to contend with, much like the family field. That we are inheritors or stewards of not only our own content, but that of our people that have come before us, or our enemies. So if we start to look at the present day cultural indicators rather than just the historical ones, there are all sorts of pieces of evidence that we've not been taught to look for that are here in all of us. And when I ask you to consider that we remember our experiences, if you take a look, for example, at phrases of speech, or how do you call that? Phrases of speech? Figures of speech. Have you ever noticed yourself or someone you know saying something like, I'm caught between a rock and a hard place? Or, I just can't breathe, I have to get out of here. Or, I feel all tied up in a knot. Like, really? I mean, I'm kind of used to this, but do you hear anything in there? Do you hear potentially, being somewhere other than where you are, and somehow something in the present could be reminding you of that? So there are all sorts of figures of speech that I find so intriguing. And when you start listening to people, you actually start to decode what they're containing or carrying or revealing about their early time. Another place that we see it, because I was talking about inconsolability earlier, and I didn't mean to say that babies and their inconsolability are the only indicators. We also see it in us, in our figures of speech, but we also see it in our posture. Now, I can't explain to you really quickly how to read someone's posture to see where they were in their birth and what position they were in and what happened or didn't happen, but there are signature postural patterns, habits, especially sleeping positions, that are utterly reminiscent of these times. And I think the most striking scientific work around memory of our pre and perinatal period, and if anyone here is pregnant, I just want to assure you that either don't listen or I'm going to frame this in a way that you don't have to take this as a fear. But these are really valuable studies that made me realize I had to write a book. So I'm going to share them with you. I was at a conference in 2007, and all sorts of studies were being shared, some of which were older, most of them out of Sweden. And they were all done by a fellow named Bertil Jacobson, starting in about 1986 all the way up until 2000. He got intrigued around people that had become drug addicts and people that had decided to commit suicide. And hospital records being as they are, he was able to access all of these people who had been recorded as being treated for drug addicts or suicide victims. He could actually get access to their birth records. So he looked all the way back to 1940. And every decade has its themes of how birth happens. In the 20s and into the 30s, it was still popular to use ether, and they anesthetized a mother completely so she couldn't feel herself giving birth, and she would be protected from the pain of childbirth. Later, things like spinal blocks, where women were given an anesthetic right into their spinal cord and they couldn't feel or move anything from the waist down. There was a period, I think a dark period in birth, where something called twilight sleep was being used, which was really a very heavy, heavy narcotic that drove a mother actually crazy to the point that she needed to be in a straitjacket so she wouldn't hurt herself while she was giving birth. Things slowed down a little bit in the 70s, but there was still this interest in It's early, but thanks. There was this interest in speeding birth up. And so I was born in the early 70s by the use of forceps, and oftentimes forceps were too painful for mothers, so they would give them a Demerol derivative, like an opiate. So all through the decades, it's pretty much signature in the population to see imprints in them. So what Bertil Jacobson was discovering, and it's harrowing, but I think it's worth knowing, is that people who grew up to become drug addicts had been drugged at birth, or their mothers had been drugged at birth with an opiate of some kind, which means a derivative of opium. It could be a Demerol, or it could have been a barbiturate, some kind of drug. And so, you could imagine, okay, so you're drugged at birth, you're going to become a drug addict. That doesn't make sense. Well, what happens if you grow up in a neighborhood where you're being tempted with drugs all the time, or a socioeconomic status where you're more vulnerable to that? So good for him. He did some studies to also account for those. And regardless of socioeconomic status, neighborhood you grew up in, even when those were controlled for, there was a statistically significant correlation to people being drugged at birth and becoming later drug addicts. He went a step further. He looked at suicide victims and again found statistical significant evidence that people who had suffered some kind of trauma at birth would later have the propensity to kill themselves. Now, it was even more specific than that. And this is where I feel a moral imperative to share this with you because, well, you'll see. He said he discovered that people who had sustained mechanical trauma, like forceps, vacuum, other types of injury, a shoulder injury, they would kill themselves by mechanical means, jumping out of a building, jumping in front of a train. The physical impact was what would meet their sense of self. People who were drugged at birth would kill themselves with drugs. And people who were asphyxiated at birth would kill themselves by asphyxiating themselves. Now, take that in, but I want to also add that I believe these studies are not predictors of you will become a drug addict, you will become a suicide victim, but they are enormous contributors, rather than predictors, contributors to a life of disease, of dis-ease, discomfort. So I say that because because today, the birthing, the style of birth today is highly medicated, highly full of interventions. There's a cesarean rate of 30 to 40% in our hospitals here today. And in countries like China and Brazil, it's up to 80%. And if you don't know what a cesarean is, it's when a mother is medicated to the point where she doesn't feel her uterus, she can maybe move, and the baby is removed non-vaginally. And it's often done in an emergency situation, so I really want to be thankful to medicine to be able to sustain life when it's in question. But in countries like Brazil and China, it's usually done by elective surgery. It's usually done because there's some belief, at least in Brazil, that women shouldn't have their vaginas expanded so that they can continue to be pleasing to their partners. And it's what their mothers did, and so it's what they're going to do. So, it was those studies that made me know that there was something that was worth saying that wasn't just my opinion and wasn't just my colleague's opinion. Because like the work that Akira Ikagawa did in Japan, these studies go under the same medical scrutiny, the same scientific scrutiny as all our medications we take, as any surgical procedure we do, anything that gets okayed by the government. Why are these studies not out in the world? I care so deeply that we get to feel and hear our song. And it's been my experience that when we have an interruption in the natural trajectory of our development, our birth, our ability to bond with our mothers, even if it's life-saving, and bless it for that, even then, that we have trouble then asserting ourselves to be creative, to be intimate, to be joyous, to be comfortable in our bodies. And that takes me to the fourth and final principle, which is it's never too late to heal. Because it's heavy, huh? I actually want to tell you about one patient. I forgot. David, father of two, married, mid-40s, was adopted the day he was born into a beautiful, loving family with two siblings. He met his birth mother when he was 30, and he was pleased to meet her. One of the things she shared with him when they met, she confided in him that, by the way, when I was pregnant with you, and she was quite young, when I was pregnant with you, I took pills so I could abort you. And you lived. And she was happy he lived, but gave him up for abortion, or for similar, adoption. Not that adoption is abortion, but you hear what I'm saying. So why did he come to me? When I was talking with David, it was our first meeting, and he was sitting in his chair and gesticulating and looking all around, and his body was not exactly twitching, but he really could not settle down. And he was wondering about why he had a sore back and why he had just started having seizures and why he couldn't get off the pain medication and the muscle relaxants. And I'm listening to him, and I'm noticing how agitated his system is, and also what a great guy he is. Like, great intentions, loves his kids, loves his job, loves his wife. He says to me, I don't know why this is all happening to me, and I'm hiding the drugs from my wife. I know we don't think of muscle relaxants or painkillers as necessarily big addictions. Oh, it's okay, or sugar, oh, it's okay. And I was remembering what he told me about when he was 2 months gestation. And I just thought to ask the question. I said, David, I'm just remembering what you told me. Did it ever occur to you that maybe this propensity you have to medications isn't because of you? And this is where something happened that I noticed. He stopped moving. He settled down. He looked straight at me, and he was very present suddenly. So I went on. I said, David, do you think that it's possible that your body learned that early that being medicated was normal, and that being on the verge of life and death was normal? Have you ever thought that maybe that experience had shaped you? And he stayed very still. Now, he never confirmed or refuted whether he agreed or disagreed, and that was the last time I saw him for quite a while. It was about 2 years later he came back. And he said, I checked into rehab right after that. And he said this: it doesn't matter whether you're a person living on the street or a Supreme Court judge. He said, this thing, and he meant drugs, it can get you. And I was thinking, how many other people who had been subjected to whatever in the womb, whatever, were like him, who couldn't settle down, who had a propensity towards self-destructive behavior. So this fourth principle, it's never too late to heal. What I've seen for many years now, including in myself, because I was, as I mentioned, I was born by forceps, and my mother was given drugs. What I've seen is that we have our essential nature, or you could call it our song, intact, underneath every circumstance that we have ever endured. Yet, it feels like some of the challenges we experience become our identity. That we, for very innocent reasons, must adapt as quickly as we can when we're in the womb to learn about the outside world, and we take it in as though this is normal and proceed as such after we're born. Or say something happens after you're born. We proceed as such in our childhood and our adulthood. And it is so sneaky how it gets into us. But I want to say that it is a purely intelligent, adaptive, loving response for your body to do that, because we're born half-baked. We're born not independent like a horse. We can't go galloping away half an hour after we're born. It makes perfect sense that we need to become as similar as possible to our environment so that we can survive and thrive in it. So that anything our mothers go through, anything our parents go through, anything our village goes through, our culture, our ancestry, we need to be somewhat similar until we are independent enough and differentiated enough that we can move forward as individuals, which I'm sure many of you have had to do or do in your lives, including me. So this work that I'm talking about, that I've done with babies and done with adults, and I'm proposing to invite you into these workshops, is about detecting your song and clearing the path for you to enjoy it more. It's not the only road in, but it's a beautiful road in to these very, very unspeakable early times that are almost impossible to reach through regular, conscious discussion. And I want to share one more story, that he was diagnosed 6 years ago with a very virulent cancer in his neck. And started coming to me quite regularly. And among the many pieces of work we did together, crossing a whole variety of ages and times and concepts and issues, what was really, really amazing to both of us during several of his sessions was that the exact location of the tumor was the exact location of his injury during birth. 50 years ago, or 60-something years ago, cesareans were done with the mother under complete anesthetic, so completely asleep. And it wasn't quite as efficient and safe as it is today, even though they're being overused. And what Adrian encountered was that the stress and the strain that happened in that area had continued on for him past his birth. And when he started to resolve those experiences and have new experiences that were basically inborn into his song, into his essential nature, by doing sessions, he began to find that the fear, the pain, even the surgery he was going to have to go through was not as big a deal as it once was. And here he is. And I'm so grateful to you and to others who are in this room who have gifted me with their trust and their stories and their vulnerability and their absolute dedication to finding their own song. I've learned so much from you, and you inspire me to share more of this with the world, and to take the risk to say it's real. As outlandish as it could be to some people that aren't in this room, or perhaps to you, I'm so grateful to have arrived at a place in my life where I feel that it's a song worth singing. And I just want to reiterate that even if you feel like therapy or revealing is not for you at this time in your life, think of it as social action, social justice, to just spread something, anything in this conversation. I really feel like this conversation is one of the most important conversations of our time, because unless people come into the world feeling like they matter, have been prepared for, celebrated, sung in, I think it's very difficult to imagine that other living things, other living people matter too. So for me, this is like a key to the ecological movement. So grateful for your time, and thank you for coming tonight, and blessings to you.